For the past 3 years, Eyelite Optical Jamaica has been staging school-centered health fairs that provide, among numerous other health services, eye checks for students of primary and high schools across Jamaica. For Child's Month, May 2012, one such health fair was held at the Halfway Tree Primary School in St. Andrew. Eyelite Optical, along with parents, teachers, and sponsors, came together to make eye testing available to students of all ages.
So far, we've seen that a lot of students, their vision is very poor. So we recommend that they do the screening and that they go to the optical booth so they can get screened. So if they need to get glasses, they can go from there.
My child comes to Halfway Tree Primary School and he's in this class, so I volunteer my time to help. Well, I take their names, I put them in line, I let them check the papers and I put them over to the other lady to let them be weighed.
With another successful health fair under the belt, Eyelite's real assistance began, and on September 17, 2012, with the assistance of NCB Jamaica and the NCB Foundation, 19 students from 11 different high schools received their well-needed prescribed glasses.
Eyelite Optical Health Fair, May 18, 2012, was the fourth in the series. It was a great success in that over 300 children did vision testing. Today, basically, we are delivering and we're giving these children glasses. Children who cannot manage, they can't see properly and they can't learn. And as a result, they are not doing well in school. Now, from the 19 schools, we have selected 19 children and we give 19 glasses today. And basically, these children came to our office, did an eye examination. They saw the ophthalmologist, Dr. Maynard McIntosh, and basically we put together, along with NCB Foundation, Eyelite Optical and NCB Bank, we put together funds and today we're actually giving these children glasses.
Head of Eyelite Optical Jamaica, Mr. Trevor Myers, reiterated the invaluable role all the sponsors played in the fruition of the health fair, but saw it fit to highlight the contribution of one sponsor who had been on board from its inception through to today's handing over ceremony.
We could not do this without NCB Foundation and NCB Bank. NCB has been with us over the last 4 years. We could not do it without them. They have been very cooperative, and you know, the NCB aim and mission statements actually speak towards education, and we know NCB give scholarships to students from the high school level into university, and I'm so proud to see them here today giving glasses to children at the primary level, preparing them for the future.
We've actually been involved since day one, and so this is probably about 3 years ago. 3 years ago, I think personally for me, the last major health fair that I was actually at was at Glenmore, which was last year, and I know that they had another one in St. Thomas earlier this year and another one at Halfway Tree, which was the last one. So what this is a follow-up to that health fair, because it makes no sense we get involved on the day and we come and we have our branding up and then we don't show that give back, we don't show that actual involvement, and this is the most important part, not just the testing but the fact that the kids have actually received the glasses. That's the most important part. And at these health fairs, the children, parents, teachers, they're all involved in the activities. One of the things that's done is that the eyes are tested, and at the end, children are able to get glasses. Well, selected students based on their needs are able to get the glasses. What NCB and NCB Foundation has done is been able to facilitate these children being afforded these glasses. So they come, they get the eyes tested. After they go through the process, glasses is done, then they come and they do a fitting, which is what took place today here at Halfway Tree Primary.
This group of recipients, comprising of students from a wide cross-section of societies, all have one thing in common: the need for corrective measures to help their eyesight, which directly affects their ability to function in school. Each, however, is in this position because of different factors.
Intern Jesse Ripple at grade 1. During the health fair, he realized that he needed glasses. He got the glasses in grade 4, which he lost in grade 5. And then they recommend him to the health fair in grade 6, which we are here now and receiving the glasses.
Brittany had an accident when she was about 4 years old. She was going to Franklin Town Primary. where a car had hit her down. She was in Franklin Town and she passed her exam to go to Conclati High. And in Conclati High, she had a problem seeing the blackboard. So I started to realize that it basically could be the accident that had caused it. So she was there and teacher called me that she's dropping back because her average getting lower than getting higher. So I realized that Brittany had needed her glasses, which in a way I didn't have the money to buy the glasses because it is expensive. And I heard about the fair at Brittany's school and they took her out as a special child to come and attend this fair. So Brittany come to the fair and she get the glasses.
Well, it was hard for me to see the board because when my teacher wrote on the board, it seemed dull to me. Now when I have these glasses, everything seems bright and clear.
Of course, a couple of them have been really grateful because, I mean, I wear glasses. It's not cheap. It's costly, and sometimes you can't. It makes no sense you have your kids in school and they're not able to see the chalkboard, they're not able to read the books. And so when you think about this additional cost in terms of making sure that they're able to have their education, when you can have these things offset for the parents, trust me, they are ever so grateful. And so parents will come and they say, you know, they're really thankful because it helps them a lot. It helps their kids a lot to be a bit more confident in their schoolwork and in class. Also, the students are, I mean, after they get over the shock of seeing themselves in the glasses for the first time, they're actually pretty excited afterwards. And a couple of them today, after you saw their faces, they were like, yes, you know, but it's going to take them a little while to get used to it. But all in all, parents and students and principals and teachers, everybody, they're really excited about the whole event and everything that's taking place.
I'm grateful, you know, because at times it helps because a parent like me that couldn't afford to buy her one and God have blessed her through this program to get one, it really stands out and I really appreciate it that Brittany can able to learn and to see and to have a better education.
As explained by Nicola Lindo, Business Development Representative at NCB Halfway Tree Branch, in addition to helping with students' physical health, NCB has products tailored especially for students to provide financial assistance.
We will discuss our start account. As you know, that is for our children. It begins at about $100, just $100 to start that account for your child, and is geared towards them learning how to save, right? As they grow, they will learn how to save and they will be a part of NCB.
With another successful testing and distribution completed, Mr. Myers, the Eyelite family, and sponsors are already preparing for the next health fair, which promises to bring healthy excitement to schools and communities of South Central Jamaica.
October 26, 2012, we are going, the Eyelite Optical Health Fair will go on the grounds of Veer Technical High School. Actually, we are working with 17 schools in the area. It's South Central Clarendon, all the schools on the coast, and we are having a family school health fair. This South Central Clarendon health fair at Veer Technical High School, it's one of its kind and it's very different.
NCB being the bank that it really is about building a better Jamaica, and we take it very seriously. We take our involvement in events, whether it be a sponsorship, whether it just be a promotion, as long as we have an interaction with persons that are there, Jamaicans. It could be children, it could be parents, it could be the old, it could be the young. We take building a better Jamaica very seriously because we are indigenous to the country. We believe we must play a role in the development of the country, and in any way possible that NCB is able to do that, we are all over it. So Eyelite Optical Jamaica, they've have this initiative. We're involved in it because we believe it is a part of that development, and as it continues to grow, as the years continue to go on, and as more children become affected and involved and, you know, are benefiting from it, we know that we're doing our job and we'll continue to do that.
The Eyelite Optical Health Fair series continues to provide hope for students and communities across Jamaica. And with the continued support of sponsors in delivering well-needed eye care, our children can look to a clearer and brighter future.